Hello and welcome everyone. Thank you for viewing today's presentation from the Health Connector. I'm Shaitra Sanders from the Massachusetts Health Connector. I'll be co-hosting today's recording with my colleague, Nikki Conti. Last week, we presented an overview of the Health Connector and resources available for those in need of health insurance coverage. Need health insurance? Know your options. We had a number of participants who signed up. Unfortunately, we had some technical difficulty with the recording, so this is a re-recording of that presentation and some of the questions and answers. Before we get started with the presentation, I would like to take a moment to thank elected officials across the state for their support in promoting this webinar series, including our partners in the state legislature and our congressional delegation. The presentation portion will last approximately about 30 minutes. Then we'll go into a question and answer period. Nikki, I'd like to turn this over to you for the presentation part.
Thanks so much, Shaitra, and thanks for watching this, folks. So as Shaitra mentioned, I'm going to just step through the presentation so you have the information, and then we're going to talk through some questions and answers that folks asked on the webinar on February 18th, as well as some general questions that people tend to ask. So I want to go through today's topics, and I intend to provide an overview of the Massachusetts Health Connector, give a little bit more information around getting coverage through the Health Connector. We'll talk about getting help with this whole process. Then I'll go back through and just, give you some reminders before I move on to some helpful resources. So yes, you'll be able to see this recording from the Health Connector's video library, but I also want you to know that you'll be able to download a copy of the full presentation. So that will give you an opportunity to click on all of the links that are part of the presentation so you can easily navigate through the Health Connector's website. So let's start with an overview, and we'll talk about what the Health Connector is. So the Massachusetts Health Connector is our state's health insurance marketplace. We offer individuals, families, small employers access to affordable health insurance coverage. So you might be wondering, okay, who are the people that are getting covered, getting their coverage through the Health Connector? And it's primarily people who are not getting their health insurance through their employer or through another person's employer. A lot of people who apply for coverage through the Health Connector qualify for help paying for it. And it's always important to note that we also, the Health Connector also has dental coverage that you can buy. So on this slide, I just want to talk a little bit about the Health Connector plans. I won't go into too much detail here, but rather just want to familiarize you with our plans generally and some of the key elements or some of the key terms that you should know about as you're looking at Health Connector plans. So first off, I want to acknowledge that any plan sold through the Health Connector meets both state and federal standards for coverage. So if anyone is thinking, okay, what type of coverage is this that I'm getting through the Health Connector, you can rest assured that it does meet all of our health insurance plans, meet state and federal standards for coverage. State standards are known as minimum creditable coverage. Federal standards are known as minimum essential coverage. You do not need to worry that if you buy any plan sold through the Health Connector, you would not be penalized when you file your taxes in Massachusetts. These plans do meet those requirements. Now, starting on the left-hand side, I also, as I made that statement, know that all of the plans are considered qualified health and dental plans. And so our plans let you choose from a variety. Shopping through us lets you choose from a variety of plans in your area from leading carriers in Massachusetts. So if you go to our website, you can see all of the different health insurance carriers that are available. And then also find out specifically who's and what plans are available to you. Now, in the center here, I want to talk a moment about health plans with advanced premium tax credits, or APTCs. Now, these are health plans and savings available to people with incomes in a certain range. And basically, this allows you to qualify for tax credits to reduce your cost of monthly premiums. Now, we also have connector care plans. People in lower income ranges who meet other eligibility requirements may qualify for these low or no cost health insurance plans. What I want to acknowledge here about the health plans with APTCs, as well as the connector care plans, is that these savings are only available when people shop through the Massachusetts Health Connector. So when you shop through mahealthconnector.org. Also, on our site, you could access a catastrophic plan, and those are available to people who are under 30 years of age or with a hardship exemption. I don't want to discount the catastrophic plans, but rather want to just acknowledge that the premiums are typically lower, but consumers are seeing the cost sharing. So you would be paying more at point of service when you go to see or go to get a benefit, use a benefit, or to get medication, etc. Now, in the center here or the middle, you've at last block, you've got dental plans. We have dental plans for individuals, children, families, small employers, including pediatric only plans and plans with lower and higher deductibles. Now, let's talk about who can apply. So when you're applying through the Health Connector, you need to be a resident of Massachusetts, a U.S. citizen, U.S. national, or otherwise lawfully present in the United States, and also someone who doesn't have access to health insurance. Now, you shouldn't apply if you are enrolled in Medicare, already enrolled in Mass Health, our state's Medicaid program, or you have coverage through another type of public health coverage program. So, for example, there are some veterans benefits that are quite comprehensive, which would not allow you to apply and get coverage through the Health Connector. Also, if you're offered affordable health insurance from an employer or someone who is in jail, again, you wouldn't be eligible to apply through the Health Connector. Now let's move on to talking about when you can enroll. So open enrollment is typically the time of year when someone can apply for new coverage for the coming year or renew their coverage or shop for a new plan. Now, typically open enrollment, the Health Connector's open enrollment is from November 1st through January 23rd. Now, I want to just acknowledge that we have an open enrollment extension right now. This is a very different time, particularly due to COVID-19. So right now, our open enrollment has been extended through May 23rd. So as you can see here, it's a time when you can review the available health plan choices, and know that when you're shopping through the Health Connector, all our health and dental plans, once you you apply, you shop, you enroll, coverage can start as early as the first day of the following month after you go through this process. I will get into payment deadlines in a moment, but just know if you need health insurance coverage, we really just recommend that you apply as soon as possible, get your application in, and then we can go from there. Now, which leads me to special enrollment periods and qualifying events. So these are times outside of our annual open enrollment period when someone could qualify to enroll in health coverage through the Health Connector. And a special enrollment period lasts for 60 days after someone has certain qualifying life events. So let's say someone gets married, they have a change in household size. Let's say someone has a child or adopts a child, or I'll move right into the middle of the list where someone has a loss of other health coverage. So let's say someone is unfortunately lost their job-based insurance, either because they've lost a position or their spouse or partner has lost their position. these are opportunities for that allow people to come on in and take advantage of a special enrollment period. So if you have questions and you're thinking about your particular situation, you can always click on the link here that says learn more about qualifying events to see the full list of these types of things that do in fact happen that would let someone get in. Now, following the thread of somebody who maybe has recently lost employer coverage, I think it's important to just start with or step through that if somebody leaves a position, they're typically offered COBRA or mini COBRA to continue their health insurance benefits. So we want to acknowledge that with COBRA, someone, in order to continue with their exact same benefits, someone has to pay the full price of their health or dental insurance that they had with the employer. Now, the pricing is usually a little bit of a surprise to people because this is, the first time, let's say, that they're not getting that employer contribution. You're seeing the cost of the plan 100% what you would be paying for. So we encourage people to come to the Health Connector to take a look to see if the plans that we have could offer some more affordable choices for them. So this is not a requirement, but certainly a good thing to do to compare and contrast your options so that you know what's going to be best for you. So when would you need to do that? So if you lose coverage or you're about to lose your coverage, you need to apply and enroll in coverage within 60 days of losing that employer coverage. Remember, losing employer coverage is a qualifying event, and that's what gives you that 60-day special enrollment period. And when you apply on the application, you need to tell us the date your employer is no longer going to pay for health insurance benefits. That's really important for us so that we can, our system can actually make a right evaluation and get you into coverage as soon as possible. Now let's move on to applying for coverage. Here are a couple of things we'd like you to know. There are 3 ways to apply for health insurance coverage. Someone can apply online, over the phone, or with the help of a community partner organization. I'll talk a bit about navigators and application counselors, but you can, again, apply online, over the phone, or with help from a trusted resource. Now, the great thing about us in Massachusetts, one of the great things about us in Massachusetts, is there is one application to find out if you qualify for coverage through the Health Connector. It can help you determine if you could get some help paying for that coverage, or if you in fact qualify for Mass Health, which is our state's Medicaid program. So at this point, I just want to acknowledge that when you do apply through our systems, know that you're going to get letters from both the Health Connector and Mass Health. So don't be surprised by that. And you need to keep those letters because they're going to help define your next steps that you need to take. Or just follow the prompts on the screen and I'll talk a little bit more about that. So in terms of things that you should gather when applying, you're going to need social security numbers for everyone who is applying for coverage, everyone who needs insurance if they have a social security number, immigration documents for any non-US citizen who's applying if they have those documents. If you want to look more closely at some sample immigration documents, follow this link on our site, and you can actually see some images of what some of those documents look like, and also, I believe, the numbers, that you need to enter into our application. Also, we're going to need recent pay information. So if you have it, copies of your last few pay stubs. If you're collecting unemployment, we need to know your monetary determination, basically the amount you're getting each week if you're collecting unemployment. And then also any other information you have or any other current income that you have. We mentioned here, if you didn't file taxes last year or your income has changed since last year, you just want to gather whatever it is that you have that is going to accurately reflect what your situation is right now. We're in the February timeframe. I think one of the questions that we get a lot is whether or not we're going to look back at tax information from 2020. We are not looking backwards. We're concerned with and thinking about, right now, and then what this year might look like for you. Now, we also don't want you to worry if you don't have all the information that we've listed above. Enter as much information that you have, and then the Commonwealth, the state's going to send you a letter that will ask for more information if they need it. On this slide here, I just wanted to show you what the landing page looks like for the online application for individuals and families. You can see our web address, mahealthconnector.org. And just below it, you can see a link to the Spanish version of our application. So it's our same website, mahealthconnector.org/ES/. So remember, this is one application for the Health Connector. You can find out whether or not you can get some help paying for your coverage. And you'll also find out if you qualify for Mass Health. On this slide, I just want to acknowledge that if you have ever applied before, you can simply click on sign in, recover your password, and then you can go back to your old application and simply update it. That really is the recommendation. We don't need you to start a whole new application. But if you have never been here before, you do need to go down and select create an account to start that process. Now, some of you might be wondering how you should enter your income if you're unemployed. So as I had just mentioned, we're not really interested in what happened before. In our online application, we want to understand what's currently happening with your income, and we need an estimate of what your income is going to be for the year, what it's going to look like going forward into 2021. So we need you to enter your current income, including unemployment income. Then, as best as you can, estimate what you expect this year. You may be collecting unemployment for a period of time, but you also may know that you're going to be picking up hours in your position at your job in May or June. So again, just a couple of notes here. You'll notice towards the bottom, we are asking you to add up your unemployment. If you are collecting any extra supplemental dollars as part of that unemployment, right now there's an extra $300 per week that people may be receiving. You do need to include that $300. And then again, as I already said, if you think you're returning to work later this year, include what might be earned. Now, really, really important here. If your income changes, know that you can update your income as you go along. And it's really important that you keep your income as up to date and as correct as possible. And it's important because if you keep your income information up to date, it's going to help you get the right amount of help paying for your health and dental insurance. It's also going to help you reduce any risk of owing money to the IRS at tax time next year. So, and you might be wondering, okay, where is this connection? What is that all about? So at the very beginning, I mentioned that some people qualify for advanced premium tax credits or some savings to help to help reduce the cost of their monthly premiums. Those come in the form of advanced premium tax credits. And what happens is when you apply for help, you are going to be like, you're going to find out exactly how many dollars you qualify for. You qualify for a certain amount, but you always have the ability to take fewer tax credits. And I'm going to show you, what it looks like in the system to adjust the slider tool to take less advance premium tax credit. If you choose to take less than you are eligible for, you could owe less to the IRS when you file your taxes. So I apologize. I'm actually not going to go into the system. I want to just note, I'm going to show you the screenshot here. So when you're in the application, on the Find a Health Plan page, there is an area that says Change Tax Credit, and you can see that circled here. And that's where you can get to the Change Tax Credit tool. So you can move the slider in this image, you can see that this person is eligible for a full amount of $117. And you can move that slider to the left to take less APTC. So when it's all the way to the right, you're taking the full amount, and you can adjust it back to take less. Now, I'm covering a lot of content, but I do want to spend some time talking about two kinds of help that you can get, two kinds of help paying for coverage that you can get through the Health Connector. So you can get help in the form of advanced premium tax credits or qualifying for the Connector Care program. So as I've said, APTCs help lower the premium amount you pay each month. The IRS is going to send your tax credit directly to your insurance company, so you'll pay less each month. And then you, as the consumer, have the ability to apply some of that amount or all of that tax credit to your monthly premium. So if you apply all of it to your monthly premium, that monthly premium is going to be lower. But if you reduce the amount of advanced premium tax credit, you're going to pay a little bit more. Now, with the Connector Care program, the Connector Care program uses those advanced premium tax credits that you're eligible for, plus additional dollars from Massachusetts state funds, and those two together help you reduce the monthly premium that you pay each month. There are low monthly premiums, low out-of-pocket costs, and no deductibles. So depending on the plan type you qualify for, you may be eligible to enroll in a plan for as low as $0 or as low as $130 per month. So we can take a look at the slides at the end of the presentation so you can get a fuller picture. Now, you may be wondering, okay, who qualifies for help paying for health insurance? So you may qualify for help if you shop through the Massachusetts Health Connector, your income is 400% of the federal poverty level or lower, you live in Massachusetts, you are a citizen, U.S. national, or otherwise lawfully present in the U.S. Now, this list should look very familiar to you from the beginning. So who qualifies for help? The one addition here is that income. There's an income threshold. Now, you won't qualify for help if you are already getting coverage through Medicare, our Mass Health program, or other public health insurance programs, or if you are offered affordable comprehensive health insurance from an employer or someone is in jail. So let's go on to the income guidelines. So I mentioned the federal poverty level guidelines, and you might be wondering, okay, what does that mean in real numbers? So on this slide, you can see that this chart has a household size, the FPL, the income guidelines for the Connector Care program, and then income guidelines for advanced premium tax credits. So as an example, if you had a family size of 3 and your income was under 86,880, you may qualify for advanced premium tax credits. But if you had that same family of 3, but now your income is 65,160 or under, you could qualify for the Connector Care program. Now let's go on to choosing a plan and enrolling. So, coming in, applying, finding out what you're eligible for is one part, but once you've done that, you need to shop for a plan. So we have all types of tools that you can use to help with the selection process. So you can enter provider and medication preferences to find the plan that meets your needs and look at your pricing options. So before applying, you can come to our website and use the plan comparison tool. If you want to simply look for pricing, you can go to the preview plans area on our application homepage. Really important to note here is people who qualify for connector care aren't going to see those cost savings displayed from that tool, but I promise I'll go back and show you some connector care details that are in the resources of this slide deck. Now, for those of you who are either wanting to do this before you apply or when you do apply, know that you can sort and enter some preferred providers and facilities, and also enter some preferred prescription drugs, medications, to help you find a plan. So this is what that screen looks like. By entering this information, this can help you narrow down your plan choices. In this example, you can see that I've entered a couple of physicians. I've entered a facility that I may want to use. And over on the right-hand side, you can see that I have, looks like 48 options. I'm only seeing about 10 right now. You have the ability here to filter these even further and also sort them. So right now, this is being sorted by best match, and that will be inclusive of the doctors and the facility that I wanted. Now, some people are required to make a monthly payment in order to enroll in their health insurance coverage. So on this slide, the My Enrollments page, I just want to point out that all payments must be received by the 23rd of the month before someone's enrollment is considered complete. So you can see that you could submit your online payment by clicking Make a Payment, and this will bring you to another system that lets you do that. You can pay by entering your checking or savings account. I think it's really important to note that we do not accept credit card to make payments for health insurance coverage. Now, let's spend a moment talking about getting help with this process. We have a couple of different options for people if you're looking for help in this process, and they are both free. So you can get some free enrollment assistance through the Health Connector customer service, as well as through community partner organizations across Massachusetts. So customer service, our telephone number is 877-623-6765. And if you follow the link from this page, you can go and review our hours of operation. Typically, we're Monday through Friday from 8 to 6. Sometimes those hours vary, so I would just suggest you take a look at our website to see if there are any special Saturday hours. Community partners. So earlier, I briefly mentioned the word navigator. So we have trained and certified navigators, as well as certified application counselors who speak lots of different languages. And these folks are sprinkled throughout Massachusetts, and they can help answer your questions about eligibility, the application, etc. Particularly now, due to COVID-19, we recommend that you call ahead to schedule an appointment to get help. Now, if you want to find help with this process in your language, you can go to this link where it says Get Free Help near you, and you can enter your zip code and also search for some language preferences, and you can find some help near you or in a language that you may need support with. So again, on this slide, I just want to stress that This is free help that's available to you. If you feel comfortable, if you feel like you're very web savvy, you're comfortable doing this process on your own, you can 100% start the application. If you get stuck, you can call customer service. They can pick up where you left off and help you move along. Same is true for our community partners. So there is no time lost in doing this, beginning on your own, and you can ask somebody can pick up and help you move your application and your enrollment forward. So really, wherever you are personally, we just recommend that you get started as soon as possible if you need health insurance coverage, and know that you can reach out and get some free help with the process. So before we go to the question and answer part with Shaitra, let's just take a look at some reminders and details that I want you to kind of step away with. So remember, losing your employer coverage is considered a qualifying life event, and that gives you a special enrollment period for getting coverage through the Health Connector. Be sure to apply and compare your options with us within 60 days of losing your employer coverage. So either 60 days before or 60 days from that date that you lost your employer coverage. Again, remember, you can apply for coverage online, over the phone, or with help from a partner, from an assister. And most people, I shouldn't say some here, most people are going to get an automatic special enrollment period to shop and enroll right away. But if for some reason you think you should be qualifying for a special enrollment period and you get stuck and you can't shop, call Health Connector customer service and they can help you kind of uncover what's going on. Now here, if you, on the next bullet here, just a reminder about dates. So we said that you need to apply, enroll, and pay for your first premium by the 23rd of the month before your coverage can start. So I'm going to change this example up a little bit and just say, okay, we're in March right now. If you're looking for coverage to begin April 1, you need to take all of these actions and pay by March 23rd for your coverage to start April 1st. Technically want to point out that you can also choose to have your coverage start in May if you were doing this again in advance. And lastly here, I think you've heard me stress that you can get help with this process, and whatever it is, if you need help with the application or you need help choosing a plan, Health Connector's customer service is here to help you. And we have enrollment assisters across Massachusetts who can help. So call today, make an appointment, and get started with the process. And Shaitra, before I go to questions, let me just pull up one of the examples here. On this slide 37, I just wanted to pull up the Connector Care premiums. So I wanted to point out here, if somebody qualifies for a plan type 1 or plan type 2A, they are eligible to pay $0 a month. And someone who qualifies for plan type 3B, the cost can be as low as $133 per month. So let me step back and hand it over to you, Shaitra, to ask some questions.
Yeah, great, Nikki. So as we are re-recording this, but I was hoping we could review some of the questions that have come up in the webinar that we are actually re-recording. And one of the questions that came up was, what income is used to determine a person's eligibility, and also how should they count that income? Nikki, you're on mute.
Thank you for that.
You're welcome.
So when I mention income, I think one of the questions people ask is, okay, your situation might be really different this year, right? You you need to think about your household, right? You need to think about all the people that are needing health insurance. So Shaitra, I'm going to kind of answer two questions here, one that you didn't ask and one that you asked about income. We need to understand your income for your tax filing household. That's what the Health Connector is interested in. So we need to know, okay, what is someone's current what is someone's current income? So are you getting any unemployment? Are you getting any I don't know, any like additional dollars coming from like another part-time gig you might have, etc. Those are the types of things we need to know about. We need to know about current, and then we need to know about anything you anticipate to get for the rest of this year. You don't have a crystal ball. We don't have a crystal ball. So I guess what I want to say here is do the best that you can, estimate that amount, then come back in and you can make adjustments. Now, I want to kind of go off to the side a little bit and go to I mentioned household, your tax filing household. We need to, let's say it's you and a spouse. And let's say you lost income and your spouse didn't lose the position, but maybe had reduced hours. If let's say you're married and you file your taxes jointly, we need to know about both of your incomes, and we need to, enter information for both of you you need to enter information for both of you. It leads me to one last detail, and then I'm going to go back to Shaitra to ask me more specific questions. But one last detail here is, if you are married, in order to be able to get help paying for coverage, so in order to qualify for those advanced premium tax credits or to qualify for connector care, you must file your taxes jointly in order to receive those benefits. So I just wanted to get that out there as well, because that isn't, everyone has different circumstances, different arrangements. Some people are married and choose to file their taxes separately. I wanted to probably get out way too much information, but I wanted you to have it. So back to Shaitra.
No, Nikki, so that goes into the next question. You had mentioned spouses. In particular, you mentioned family household. Who should a person consider part of their household when completing the income part of the application? And you definitely pointed out joint tax return for spouses, but what happens when a family has working teenagers or adult children? Are their incomes also included?
Okay, that's a great question, Shaitra. Thanks for asking. We are interested in anyone who is a tax dependent. So if you are, let's say you have, I'll try to keep this super simple, but let's say there's 4 of you, they're your tax dependents, you and your spouse and 2 tax dependents, 2 children, and everybody needs health insurance coverage. So you could, enter all of that information in. You would enter yourself, your spouse, their income, and enter your tax dependent. Depending on, and again, everyone's circumstances are different, but it's not inconceivable that you and your spouse become eligible for a health connector plan. And sometimes your children become eligible for mass health. So it's not inconceivable that you enter all this information and a couple of you are eligible for health connector plan and a couple of you are eligible for mass health. So that is a very common thing that happens. So I wanted to get that out. And again, just to reinforce Shaitra's question, really just concerned about tax dependence.
Great. I think that would definitely be the answer, Nikki, the tax dependent part. Now, before that, you had mentioned estimating income.
Yes.
Yep. There's questions around unemployment. How does one estimate their income if they're currently unemployed?
Okay, so here, just to keep it as practical as possible, um, you would want, so in Massachusetts, I mentioned that term monetary determination. It doesn't really roll off anyone's tongue, right? But you either got an award letter from the state's Division of Unemployment Assistance, or let's say you don't know where that is, you may be able to go online into your account, um, see what you're making each week, find out if you have any additional income, like any like supplemental dollars that you're getting, like from federal stimulus dollars. Right now, I believe that's an extra $300 that people are getting. You also need to try to estimate and find out how many weeks you're going to be getting that money. So you want to count any unemployment that you started getting from the beginning of calendar year 2021. I had said we're only interested in looking ahead, but when you're, excuse me, this is something I have to go back on. We're interested in looking ahead. You're going to have to answer questions about current income and then answer questions about annual income. So current income is just what it sounds like, what it is you're making right now. Annual income is looking at everything beginning from January 1 and trying to determine what your income is going to be all the way through the end of 2021. Does that help, Shaitra?
Sure, yes. And I do remember, I also recall a question, which is good to follow up on this one. Some of the people who are currently unemployed have not yet been approved. Is that when they get that amount, would that be a change that they put in later that they report?
Thank you. So let's say you know you're losing your position. You know you're going to file for unemployment. You don't know exactly what that amount's going to be. I would recommend checking on the mass.gov website. I think there is an unemployment amount estimator tool that you can use, so you can kind of figure out, okay, what could I be getting for unemployment? So that's a good number to use. But then once you do get that award letter and you know exactly what you're making, as Shaitra said, yeah, or was asking, you were asking, like, can they come back in? And 100% yes, come back into the application, either on your own, or if you got help from customer service or a community partner, pick up the phone and call and say, okay, I now know the real number. Could we um, update that information? So again, your application is as up to date as possible. It's as accurate as you know it to be. You're going to get the most cost savings that you're eligible for. That's really the best recommendation we can make right now.
Great, thank you, Nikki. And earlier in the presentation, you were talking about 400% of the federal poverty level. And so under 400% of the federal poverty level, you may be eligible for advanced premium tax credits, from my understanding.
Yes.
What if the income is over the 400%?
Yes. So what I wanted to do here, Shaitra, do we have a moment, you think, to just show people?
Sure.
Okay. I'm going to try to do a new share with you. So basically, if somebody, okay, are you able to see this? Our landing page?
Yes, it's there.
Okay, great. So I am starting from our landing page and I'm just going to quickly look at something here. I just want to point out that if somebody already knows that they're not going to qualify, or if somebody thinks they're not sure, you could use this tool to see what you might qualify for. This is a really, really, really simple screener tool where you can enter your zip code, an estimated start date, and you can see if you, based on the information you have, if you think you could qualify for help. Now, let's say you already know, let's say you lost a position or your spouse lost a position, but one of you is still, you know you're going to be over income. You can click on preview plans, enter some very simple information, and you can look for coverage that's available in your location, and you can start sorting. So here I just entered just a couple of things. I could see all the results. Right now they're being sorted by low to high. I could say, all right, well, maybe I know just going to do, I'm going over to the left-hand side. I'm looking at a couple of filters. I want to point out that you have lots of options if you want to filter. You can filter by carriers if there's a particular carrier that you want to shop for. You can filter by coverage level. So let's pretend that you want to be somewhere in the platinum and the silver range. Excuse me, not platinum. Let's say gold and silver when you're looking at your plans, and you can apply those filters. And you can start to filter out your plans that way and look, you see how the cost changes. Then if you wanted to enter some provider or medication information, you could also do that. I won't go through this just for time's perspective, but this is where you could enter a couple of your preferred providers, facilities, and then your plan results would be filtered using those criteria. So hopefully that's answering your question, Chayitra, which is like, okay, if I am, I know what my income is over that 400% threshold, how can I shop for a plan, and what are my options?
So these are showing full premiums, Nikki.
Yes, they are.
For those who are under the federal poverty, the 400% FPL, would this tool also assist them with seeing how much they might get for an advanced premium tax credit?
No, that is a really good point, and that's why I want to guide you back to the presentation. And when you get the slide deck or you download the slide deck, you can see if if their income range is between 0 to 300% of the federal poverty level. You can see based on the plan type, this is the lowest cost plan that is available to them. These are the connector care benefits and the associated co-pays that they can expect when they enroll in one of the connector care plans.
Thank you, Nikki. And we were speaking about estimating income, as going on shopping if we're thinking that we need coverage. How far in advance can a person shop for a connected care plan or a plan through the connector if they know in advance that they're going to lose health insurance or not have access to health insurance in the coming future? How far in advance can they apply?
Yep. So great. This is a great place for a reminder. So as I said, if you are losing employer sponsored insurance, you have 60 days before and 60 days after the date of your loss of coverage. So you can, if you know something is happening, let's say you know something is happening May 1, 60 days from there, you could start this process. So you could begin this process now if you knew that your coverage was going to be ending on May 1.
Thank you, Nikki. And I think another point to just ask about is you mentioned navigators and certified application counselors and asking for the help, even though you can do this on your own. Just as a reminder, this help is free. Am I correct?
Yes. So all of the help that is available to you is free. There are no fees. You can, again, as Shayitra just mentioned, you can start this process on your own. Or if you just don't feel comfortable, you can contact Health Connector customer service to begin this process, or go to a local navigator. And I say go to, I mean that loosely. Contact a local navigator, especially right now. Most are doing appointments virtually, either telephone or over Zoom, and helping you begin this process.
Thank you, Nikki. I think I pretty much have covered what we have usually seen as questions during the webinar, and especially the one that unfortunately did not get to record, that we're re-recording today. Was there anything that you thought would be helpful to add on to this presentation?
I think the only other thing I'd want to mention if someone is viewing this is, we have a wealth of information on the Health Connectors website. Just go to mahealthconnector.org, move around the site, look at the information. If you want to hear a video, we've recorded these monthly webinars so you can listen to information again. We also, Shaitra, you asked me some of the common questions, but we have some other questions that people have asked. On our video library, we also have included some of the other questions that people have asked. Again, everyone's situation is different. You just, and if you can't find your question, not a worry, reach out to us, reach out to customer service, reach out to one of our partner organizations, and simply just apply. We'd like to get you covered.
Well, Nikki, I think this has been very informative, and I'm sure this recording will be very useful for individuals who come to it. I want to thank you today and everyone who attended last week, and those who come to see this recording.
Thanks so much, Shaitra. And again, don't hesitate to reach out, folks, if you have any questions or need some help with this process. Be well.